What's up, Jammers World? It is Coach Dan here, and we're continuing our joint therapy series right here with going on to the elbow. So we started with the shoulder, we had our two-part series on how to kind of strengthen the shoulder, work on that stability, focus on that external rotation, getting that strong position for that shoulder, as well as kind of some release through the tissues. Now we're focusing on the elbow joint, so a little bit downstream instead of an upstream issue. Elbow joint, a lot of tweaking, a lot of kind of injuries that occur in these two areas generally with CrossFit, because we do a lot of pulling movements, a lot of kipping, a lot of pressing overhead or vertically through the rings as well. So what we're going to do is we're going to try to find some ways to take care of those nasty spots, especially if you have elbow pain. And first thing we're going to talk about is where most elbow pain happens, and it's generally medial, so on the inner side of this elbow right here. Through the elbow, wonderfully created joint, all right? We have a lot of innervations that come through here. What we're going to focus on is the bicep tendon itself. We do a lot of pulling in the activities we do, all right? A lot of strong pulls, a lot of high rep pulls, whatever it may be, affects the tissue here. So our bicep muscle, our biceps brachii, controls right through here. It allows us to basically do elbow flexion. Upon that muscle where it inserts, the tendon innervates along the base of the elbow with a little strip here. What happens is we get a little bit of aponeurosis kind of happening, and that little irritation is basically the tendon thickening and all that tissue kind of getting knotted up, pulling back. Now if you remember, we have a lot of innervations coming through this elbow. We've got all our forearm muscles, all our flexors coming through, as well as some of the extensors attaching on the lateral side. So when this muscle, when this area becomes irritated, we have a lot of issues, a lot of pain can occur. You'll feel like a badger just biting at your arm, and yes, that can be the metaphor you can actually work for, right? So what we're going to focus on today is kind of getting through those corners and really attacking that tissue and allowing that tissue to open up. Stretching is not going to be enough for this. We kind of have to attack it from a different angle and really focus on that joint capsule and getting those tissues to innervate properly and restoring that good flow of the tissue. Anything knotted up, it's going to pull on other things, and it's just like a domino effect. Push one down, the rest of the things are going to start to fall. All right. So what we're going to focus on first, lacrosse ball will be for later. We're going to get the band set up, just like so. And what we're doing with this band, all right, is you're going to position it just around. Actually, a little this arm, probably a little better. Just around the base of the triceps and above the elbow. So you want it above the joint, right? If you have a voodoo floss band, any flossing bands, it'd be phenomenal as well, but this will have to work for now. Positioning the band and my hand in front of the post, so I don't want to be to the side of it, and I'm going to lean my arm back, right, until I got a good degree of tension. I feel that band kind of pulling my weight forward, right? From here, I'm going to make sure my fingers are facing that post, right, and I'm going to take my other hand and lock on top of my fingers to keep that hand rooted. Very similar to our ankle joint, we're talking about the wrist here, so we're going to keep it rooted. Now we have an active distraction to this band. It's allowing that elbow to come forward, and we're going to work those corners. We're going to work those edges of where we talked about the biceps innervate, that aponeurosis that we see, that little inflammation, that tenderness that can occur. And all I'm going to do is I'm going to work on my kind of external rotation, tucking that arm in. I might do a soft bend and allow it to come back, kind of turning that joint out, really working those corners, leaning back, focusing on the breath, allowing that tissue to kind of breathe and move. And you're going to hold this for about 2 minutes. It's a minimum you want to shoot for. We talk about this all the time in our videos. Soft tissue doesn't really start to change until you hit that 2-minute mark. So set those clocks and go for it. Hit those corners, feel where it hurts. Nice and easy. Add a little bend if you want, and control. Careful coming out because you will get a good little pull on that. So shake it out. If you do not have any elbow pain, do you need to be doing this? No. You've got healthy tissue, you're feeling good, right? If you're starting to feel that elbow joint act up, all right, especially if you've had a heavy lifting or gripping workout, deadlift, pull-ups, things like that, might be something you want to consider working on your own time to prep the body for that, all right? Also be mindful, this band is pulling, right? Good degree of tension, especially on this type of thickness of a band. So be mindful of where your elbow is being pulled. It's being pulled forward. So always keep a nice little degree of tension in where you're pulling and where you're turning into those corners. All I'm doing with my arm is I'm turning the arm in, I'm working those edges, I'm trying to expose that inflamed tissue, that joint capsule, and getting it forward and kind of breaking up that mold, breaking up that tension. That's not allowing me to extend my elbow fully. If I'm having issues with full elbow extension, Well, that's not normal. You should be able to fully extend the elbow. You should have a healthy degree of a little bit of hyperextension as well. All right, just like with the knee. Second part to that, I had my fingers facing forward. We're going to talk about band goes in the exact same place. Get that tension. Now I'm going to flip my hand. So I'm going to turn my fingers back, and oh man, you will feel this one. All right, you're stretching all the flexors of the forearm, getting back, working the edges of those corners, kind of turning that arm outwards a bit, and working on that nice tissue right in there that connects all that elbow together. Beautiful and breathing. Same time, base goes for this one as well. Coming out nice and careful, and you will feel this, trust me, it should feel good. It should not feel like a crappy pain that you just came out of, right? You were helping the joint here. Getting at that tissue like no way else, right? That's the only way to kind of get at that joint capsule there, right? Once you've done that, you can kind of hit some other spots to kind of help along with that elbow, right? With the lacrosse ball. It can be any fine point, golf ball, hockey ball, yoga ball, phenomenal, can grip that tissue. You're going to talk about that. Where you're going to place this ball is you're going to go kind of just under that little groove you'll feel through your tricep and just under the elbow, all right? What's going to happen is, I'm on the ground here, got the ball, set it down. I'm going to apply some pressure with my arm, all right? If you feel it when you go on without the pressure, that's fine. You do not need to add your hand to that. What I'm going to add for the purpose of this, I'm going to find a spot right in that center there, right above my olecranon process right here. So that little elbow cap right there. And all I'm going to do is I'm going to apply that pressure, and I'm going to begin to flex and extend right through that tissue. And this is not me making a voice, this is me feeling this working, because I'm tight through here. And all you're doing is you're essentially flossing the joint. So you're taking that tissue through its range of motion, and you're allowing any impedance, so any tissue that's tight, to kind of restore that natural range. And you're just going to go until you start to feel that pressure subside. Alright? That's a great way to work it out too. Specific time limit for this one, feeling. Go by feel. Don't worry about the clock for this one. Go by when you start to feel that tissue loosen up, when it starts to feel less and less agonizing, I guess. Alright? This is good for you. It hurts so good, as we say. That's elbow therapy 1 for you. Enjoy it, folks. Practice it. Stay healthy. Peace!